Hi, I'm Dr. Julie Steinauer, and I have an interesting case to talk about with you today. It's a case of amblyopia, strabismus, and strabismus surgery. So there's a lot going on. But this particular individual came to us after a couple of surgeries, did not correct the alignment issue with her eye. So what was the problem? Well, she has an exotropia where the eye turns out, and it wasn't corrected by multiple surgeries because at the root of the problem is, and really the reason why she's doesn't have that eye lined up in the first place, is she's amblyopic. That means she doesn't see well with that eye. So because the brain is not really relying on that eye for usable functional vision, the brain just decides to shut it off and kind of let it turn out and do what it wants to do. So that's where her exotropia, or eye turn out form of strabismus, has come from. It's because she actually does not see very well with that eye. She's amblyopic. So what did she do? She wanted to have the eye corrected. She didn't want to have misaligned eyes, so she went and had surgery. The problem is that the brain hadn't corrected the issue of not seeing well with that eye. So after a short amount of time, it wasn't even just a few months, the eye turned back out again. So she had another surgery. Eye turned back out again. All right, enter us to say, here's what we need to do. You can have surgeries until the cows come home. But the problem is that the brain is not really connected with seeing with that eye. And that's going to be an integral and crucial part of training your brain to align that eye, is actually seeing better with the eye. So what we're going to do with her now that we have her signed up and working with us is we're going to train her brain to see better with the amblyopic eye, and hopefully our goal is to be able to get her to be equivalent, so she's the same and not asymmetric between her right and her left eye. And if we're successful, then certainly we'll definitely get the brain to align and use the two eyes together as a team. But even if we don't get her exactly where she needs to be eyesight-wise, as long as it's pretty close to the other eye, the brain will still align and learn how to use that eye together because we'll train it to do that. That's what's really cool about this. Now, we are very successful. Most of our patients do end up achieving kind of non-amblyopic status where the two eyes see equally as well. And you know, we even have some really challenging cases, some really hard cases. We do have some cases that are not able to achieve equivalence in eyesight. And those typically are specialized cases where a very high lens prescription is existing in one eye. Maybe there's a disease process or something else that's going on. But in her case, nothing like that is happening. It's fairly low in lens prescription. There's really not a lot going on other than she's not seeing well with that eye, and the eye's turned out. So we should be able to get the brain to pay attention to seeing clearly with that eye and bring in the alignment of the eye to get her true normal binocular vision. Now, I'm sure at some point I might be following her case and doing another video, so hopefully you'll get to follow along with us. But if you're thinking, gosh, maybe what's going on? Like, I've had multiple surgeries and it didn't correct my problem. Or, you know, I've got amblyopia and I don't see well and I'm adult. Can you correct and fix that? The answer is yes. So if either of those scenarios are you've had multiple surgeries, yes, we can help you. Or you're amblyopic and you're adult, what can be done about that? Yes, we can help you. All right, then contact us if you're local. That's the way to go. So local people, call us at 618-288-1489. If you're not local and you want to see, how could we work with you in New Zealand, then go to our website and fill out the questionnaire. Then we will get back in connection with you. Now, I'll tell you, it might be 4 to 5 days before we get back in connection with you because we have just so much volume coming into our clinic. So please be patient with us as we try to work through all of that volume to be able to respond to you, but we will. And then we'll talk to you about how we might be able to help you. Now, if you like this video, then hit the like button and also subscribe to the channel so that you can get more of our videos that come out on a regular basis. Thank you.